So, good morning, shalom, buenos dias, and welcome to this LinkedIn live event by Bayer. It's great to see so many people joining in from all over the world. I see people from Latin America, Australia, US, Asia, and Europe calling in. A big and warm welcome to all of you. My name is Hugo. I'm the Managing Director of Bayer Israel, and I'm going to be your host for the next hour. And I believe we have a great hour ahead of us. So during the next 60 minutes, you will get to learn more about Bayer's G4A program, meet some representatives from some highly innovative and exciting Israeli companies who has worked with Bayer and G4A in the past, and learn more about the Israeli innovation ecosystem. So first, why do we do this kind of meeting? What is it we want to achieve? Short answer, collaboration. Bayer is constantly looking for innovative, creative, agile startups and companies who would be interested in collaborating with us. And one way of facilitating this collaboration is through G4A. And during today's session, you'll hopefully learn more about what G4A is all about. And who knows, maybe our next collaboration partner is listening in on this event to that. With that being said, I would like to introduce you to our speakers today. With us today is Mike Devoy, Chief Medical Officer, Head of Medical Affairs and Pharmacovigilance in Bayer. Karina Rubinstein is jumping in on a very late notice for a person who unfortunately had to hand in a sick leave. But Karina Rubinstein is Senior Director of Business Development at the Israeli Innovation Authority. We have Michal Meiri, the CEO of Agamon, Yossi Bahagon, co-founder and chairman of Sweetch, and Dominick Kennerson, which is the global head of G4A. So to all of you listening online, please take the opportunity to interact with us, give us feedback, use the keyboard to punch in some comments online. We would really appreciate that. And if you don't mind, also ask us some questions. I cannot guarantee you that we will be able to address all of them, but we will try our very much our best during the next 55 minutes. Word to you, I just have to read something that I found on the G4A internet page. It says something extraordinary. Bayer G4A works with extraordinary people to develop new health solutions in the digital world. We are a global team of intra and entrepreneurs enabling positive disruption to change the experience of health. I can only say, wow, you set yourself an amazing target. Dominick Kennerson, head of G4A, you're responsible for making this happen. Please, the word is yours.
Thanks so much, Hugo. Yeah, it really is an honor and a privilege to work with G4A. And so much of that, I mean, to be fair and transparent, I don't even think it's a target. And I think that this conversation that we've had today actually points to a lot of that, because that really is our reality. You know, I think we've heard that from Mike Devoy, from Karina, Michal, and Yossi. And of course, you all would put me after Yossi, who is always a tough act to follow. So I was asked to speak about telehealth, which I think is interesting. And I think there's a lot that we can learn, especially right now. What I've heard from the other presenters absolutely aligns with everything that I've been thinking about. The way that I set this up, I have about 5 minutes and probably at least $14 billion of information to go through and about 2 different health systems to compare and contrast. So I'll try to do this expeditiously, as expeditiously as possible. So I just have like 5 big points, really. I'll talk a little bit about social determinants of health, especially how those relate and connect between Israel and the US. Some public policy and viewpoints, mostly from the US, which large healthcare system, very complex and complicated, where we can learn a lot from. And then I'll talk a little bit about financing, again, through the lenses of Israel and the US, and then some cross-border considerations, which again, as a global unit, is something that we're always taking a look at. So we've heard, I think, quite a bit already today about the 3 pillars that you see on the left. So social determinants of health, artificial intelligence, thank you again, Yossi. We've heard the public policy and regulatory environment mentioned quite a bit. And as a healthcare company, you are normally breaking down those big components into NCDs, or chronic diseases, population aging and healthy aging, healthcare spending, and sustainability. That was at least in late 2019. What we learned through COVID is that we learned how important all of these three buckets really are, because then if you had an NCD, you were at increased risk for COVID. If you were older, you were at an increased risk for COVID. And then the conversation around healthcare spending, which is a little bit about what I will talk about, that has changed a lot into investing. And I think I could have actually renamed this presentation, so to say, to Digital Health has Grown Up. And I think 2020 showed us that, and Q1 2021. So these next few slides, I will show you one slide on social determinants of health, which is this slide right here. Essentially what that means is that your social determinants of health is everything about you. It's if you have a fresh food market in your neighborhood, it's the number one predictor of your health is zip code. It's a lot about what Yossi was saying. Who are you as a person? What's your profile? It encompasses your education level. I think it's really interesting when you look at the data at a very high level between systems like the Israel and the United States, for example. One, Israel has very relatively high life expectancy, higher than the OECD average. US has lower than the OECD average. But then when you look at the far right column around self-related health, what we see is that US is a 2.6. So what this means is that most people in the US think that they are very healthy, as opposed to Israel, where 10% think that they are very unhealthy. But the data around mortality and morbidity don't really suggest that at all. And I think this is interesting for people like Yossi or Mihal, because then how do you think about developing a healthcare solution or addressing a challenge in your healthcare environment? Then, very quick summary on public policy and viewpoints. At the top above the timeline, I have a few kind of public policy highlights, again, from the United States. At the bottom there, below the timeline, I have some high-level survey data from a company called Health Union. Health Union, they have online communities, over 24 online communities. I thought their data was really quite interesting because they have a population set that is 100% chronic, and they had 4 or 5 different surveys last year to unlock and talk about telehealth and telemedicine. And what you see here is that throughout the pandemic in 2020, all of their survey respondents essentially said that they were going to embrace or adapt a telehealth appointment, to where by the end of the year in 2020, 3/4 said that they actually did have a telehealth visit. And again, to Yossi's point, this brings into the conversation, and what they really started understanding is that you have stratification or differences based around gender, age. So we heard, if you're over 55 or over 57, how do you actually use healthcare technology and information, income and education? So again, this gets a little bit back into social determinants of health. I think what's really important, and we heard Mike Devoy mention this earlier, if we go back to above the timeline, everyone knows about the global public health emergency. This had kind of a ripple effect around the globe, especially in the regulatory space. So the US FDA, they put out their first guideline documents about a year ago. They followed that up around this time last year to focus on mental and behavioral health. And what we've seen from a financing point of view, which I'll talk about on the next 2 to 3 slides, is that this really kind of opened the floodgates. What this means right now, late 2020, actually, a lot of the kind of, without being too technical, the physician fee schedule changed a bit, and then it's still focused on rural. So that's a place where Congress and where a lot of advocacy organizations are still focusing. And then what we actually have in US Congress is the upper house and the lower house are working a lot on this in a bipartisan way. All this says is that digital health went gangbusters last year in 2020. I think if you were to break down that 14.1 billion in US digital health ecosystem spending, it would be about $44 per person. When we look at Israel, So about 95% of healthcare funding in the Middle East comes from Israel. If we were to break that down on a per capita basis, that would be about $55 per person. So even going back to Karina's presentation, this is a highly innovative ecosystem. What we saw last year is that telemedicine and remote monitoring, both, which comprise telehealth, played a very large role in funding for Middle East and Israel. That was kind of broken down around treatment, awareness, adherence, clinical workflow, non-clinical workflows. The two largest categories were absolutely around treatment and awareness. What does this kind of mean going forward? So I was actually surprised that the World Health Organization, they put out a lot of information late 2019 around their digital health strategy. What they have not done in some time is actually update their telehealth framework. But what they did say back in 2016 is that there's a lack of funding, a lack of infrastructure, competing health systems. All of that has changed in 2020 and in 2021. In 2021 alone, in Q1 2021, US, I think, total digital health venture investing was 6.7 billion. So almost a complete total from 2019. And what we're seeing is that there are some very large telehealth deals that are creating, I think, new kind of market validation points. There's a company like Ro, Lyra Health. A lot of that kind of built on the back of the Televango deal that took place in Q3 last year. I already mentioned the bipartisan activity. These market models and value pools, again, when you're valuing a company, when you have a Televango or a Teladoc and Livongo merger or acquisition activity, that is public information that a lot of other companies can build their valuations on. So that's happening. I think an opportunity for Israel will absolutely be in the space for telehealth and cybersecurity. Again, we've heard about the innovation context for Israel. Cybersecurity plays a very large role in that. Again, that could be an opportunity that Karina and her team could look at. Mike Devoy mentioned integrated care. Yossi as well. And I think what integrated care really means, when you have an AI system, you can then have a very seamless kind of a behavioral change modification experience to impact your chronic disease. And with that, I'll stop.
Dominick, thank you so much for your presentation. Highly interesting. I'm sure we could talk about this one much, much more. Sorry, we didn't have more time. 2 minutes left of the meeting. I also want to recognize people who actually took the effort and wrote to us online, posting questions. And I really would have liked to take the time to address these questions. Now, apologize if I mispronounce your names. Faride, Hossein Khani, thank you for your question. Highly appreciated. I'm sorry we didn't get to it. And the same also with Utso et Saike. You had an excellent question online today. Unfortunately, we couldn't reach this one. With 1 minute left of this session, it brings us to an end of the meeting. I would like to take the opportunity to thank all speakers for their excellent contribution tonight. I would also like to thank all the people working behind the scenes making this event possible. And a special thanks to the dream team of Nama, Inbal, Danit, Alon, Dennis, Sophie, and Scarlett. Thank you so much. And thank you all of you guys for joining us online. I hope some of you came back from the first meeting we arranged. I promise there will be another Digital Health in Motion meeting from Israel. I hope you enjoyed this as much as I did. I hope you got inspiration. And from the startup companies, maybe from the authorities, and maybe now this is the little push you need in order to go forward with your idea. If you'd like to see this event again, there was something you missed, certain parts you would forward to your friends, it's going to be posted online on LinkedIn in a recorded setting. Thank you. Laitraot, à bientôt, auf Wiedersehen, goodbye, god kväll, and thank you so much.
Thank you.
Thanks, Hugo.